I remember back in 1997, our first year of PT school, back when PT school was just junior and senior year before they transformed it to a doctorate. We had somebody come in and give a 15-minute talk or so. I don't remember whether it was a direct representative of the APTA or if it was one of the staff members from our program. But they talked for a few minutes about why we should all join the APTA. And there were even lowered student rates for us. I think it was something like $50 or $100 a year. I can't remember. But how beneficial it would be to be members of our professional organization. And I remember our director was sitting in the class listening to this. A very no-nonsense woman, very, very competent, very much living in reality. One of these people has probably just been good at everything they've ever touched their entire lives. And she mentioned after the little talk that she was a member of the APTA back when she was a student and had never been a member since. Which is funny because in today's world, she probably wouldn't have even been hired as a professor, let alone a director, unless she was a member of the almighty APTA. Well, for myself, student rates or regular rates, I have never been a member of the APTA, and I never will. Now, few of you who've seen my videos know my temperament, know what I feel about the profession of physical therapy due to our massive lack of ethics in the field. And I'm contending that not only am I never going to be a member of the APTA, no one should join this organization, and if you are a member, you should leave. I hope one day the APTA just goes out of existence because of a zero membership. So why do I feel this way towards our professional organization? Because in the 25 years that I've been a physical therapist, I haven't seen the APTA do jack squat for our profession. First of all, I can't understand why any one of you would want to join the very organization that puts you in an average of $150,000 debt to gain a doctorate degree for an entry-level position. This was largely the brainstorm of the APTA back in the late 90s before they started transferring programs over to the doctorate. Their awesome idea was that everyone was going to get direct access because the insurance companies would realize we're doctors too. And guess what? We got minimal direct access in some places, but generally that did not become the norm because the insurance companies recognized that we weren't doctors. You're not specialty doctors because every specialty doctor went to medical school, and your program itself is not real graduate school even though it is on paper. You don't do one single thing that a graduate student does, and that includes your thesis. You want to argue that point? Then explain to me why the graduate students have about a 50% failure rate on their first defense, but everyone seems to make it in PT school. You don't do orals, you don't teach lower level classes, your thesis isn't nearly in the caliber of a real graduate student, and you're entry level, which makes the title oxymoronic to begin with. But they did get you about $150,000 average on debt, which will be $250,000 if you only pay the monthly minimum with the accumulated interest. This is the APTA's brainstorm that got you in this massive debt. I don't know why you'd want to shell out a few $100s a year to support them. If anything, all the new graduates should have nothing but animosity towards the American Physical Therapy Association. But outside the debt, which I thank the great Yahweh that I didn't accumulate since my program was a mere bachelor's for the same entry-level degree, there is a bigger picture of why I will never be a member of the APTA. For what exactly have you done for the physical therapy field in the last 25 years that I've practiced? What have you done to make our profession ethical? And our profession is not ethical rampantly. Let's start with all the clinics that are treating multiple patients at a time. This was going on even in the skilled nursing units way back when I worked those years ago, under the term called dovetailing. In other words, seeing multiple patients at a time. I lost contracts as a traveler because I wouldn't engage in this. And anyone who worked skilled nursing years ago remembers that the reimbursement was under something called the RUG system, which I don't think they use today. But basically, you got more reimbursement based on the time that you saw the patient between physical, occupational, and speech therapy. And on the physical therapy side, everybody was scheduled 90 minutes. So if you have 10 patients at 90 minutes, the only way you can see them is to see multiple patients at a time, which means your stroke patient wasn't getting any sort of decent care at all. Now, they don't use the RUG system anymore from what I hear, but I also hear there's still many unethical practices going on in the skilled nursing facilities, which I gave up working in well over a decade and a half ago. But you know what I heard from the APTA in all that time? Exactly nothing. Oh, I'm sorry, they did mouth lip service about how the clinical judgment of the therapist should dictate whether they see multiple patients at a time, but the fact is they know this was going on rampantly and the judgment was erroneous most of the time. But it's also in the outpatient clinics that see multiple patients at a time, those clinics which I refuse to work in, and which unfortunately is the majority of clinics in the United States. Again, the APTA gives great lip service. It's going to rely on the ethical judgment of the physical therapist, when they know bloody well that the ethics have gone out the window. Where exactly were you on that front, APTA? Oh, that's right, you weren't there. Because the APTA should have been propagating the outlaw of all these type of practices of seeing multiple patients at a time, whether it was in skilled nursing or outpatient clinics. And the fact is, you weren't. And you've had over a quarter of a century to try to prove me wrong. Same issue with the use of techs, which are nothing but off-the-street aides in the outpatient clinics, and many times in the hospitals and skilled nursing units as well. Where were you, APTA, trying to push to make these type of practices outlawed? Again, you gave a little bit of lip service about ethical judgment of physical therapists, but largely, you weren't there. And the reason all these clinics use these unlicensed techs under the direct supervision of the physical therapist is because it is well known that it is far cost effective. They don't actually have to hire the higher paid physical therapy assistant at the very least, when they can just use somebody who's off the street who's not a medical practitioner at all. The fact is, APTA, you know this is garbage treatment, you know it's going on rampantly across the United States from coast to coast, and you have done nothing. And how about the issue of continuously seeing these chronic pain patients over and over again who can't be resolved? I know some of the high-ranking members at the national level in the APTA, as they're propagating this new pain science and functional skills to justify seeing these patients repeatedly. Now, I'm not saying that pain science isn't relevant. I'm not saying that centralization doesn't occur. What I am saying is you can't solve these type of patients. You've done this great job of being on the bandwagon for the use of these functional scales, but the functional scale scores don't really matter if the patient keeps coming back over and over. It is not only completely unethical to continue to see patients that can't be solved, which is usually because of lifestyle, it is wasting billions of dollars in the country. Again, where have you been, APTA, addressing this? You haven't. You see, going all the way back decades ago, you were too busy pushing Vision 2020. You were too busy transforming an entry-level PT program into a doctorate and getting all these students in unbelievable debt when they graduated. Many who are wailing on the social media today wishing they had never come into the field. And most of them are going to work in mainstream physical therapy, and they're going to be burned out and miserable because of this rampant lack of ethics, which all stems down to seeing too many patients per physical therapist. And you have addressed this not at all, outside of that little bit of lip service here and there. And not only have you not addressed all these massive ethical problems that I'm speaking of, and your new brainstorm is that perhaps PT should go to residencies after completing their doctorate, which is on top of an unrelated degree for an entry-level program. That is awesome, APTA. Like they're not in enough debt, and when you go to a residency, you're going to have a reduced salary, which is going to impede you from immediately paying off that debt. And the reason they're doing this is they're trying to convince the insurance companies once again that we're doctors too, when you're not doctors. You're not specialty doctors medically, and you're not even legitimate postgraduate doctors, period. And when I have volunteer students who are already shadowing and they're in college or even high school and they're considering PT school, I tell them do not apply to PT school. 1, because of this massive debt. 2, because this profession is a disaster. And I'm definitely telling them not to go if you add a residency to the curriculum, because you're going to tack on even more time to get this entry-level degree. Once again, trying to convince the insurance companies you're specialty doctors, and once again, they're going to recognize that you're not. The problem with the APTA is they're largely la-di-da high-level academics now. They all sit in the land of great ideas, like transforming the regular PT degree into a doctorate to begin with. That worked out well, didn't it? They don't live in reality and never have as long as I've been associated with the profession. And that's why I've never been a member of the APTA and never will. Because you, APTA, the organization that's supposed to be on the side of physical therapy, you have been nothing but a detriment.